Have you been having shoulder pain and you're not really sure what to do about it? So today we're going to talk about what we can do here at Chiro Health Spa to help you figure out what's going on with your shoulder pain. So I'm Dr. Joe Labriola, Chiro Health Spa, Ramsey, New Jersey. I'm going to walk you through a couple of things and how we approach the shoulder, because we also look at it as the shoulder might be part of it, but it may be other things going around it. So let's take a look quickly at a little bit of shoulder anatomy just so you see what's happening. So the shoulder is a ball and socket joint, so it's going to sit right into that little socket right there. So you got the big ball, this is the humerus here. We have a joint right up in the front. This is called the AC joint. So this is the front of the right shoulder. Now if we look at the back, this is actually the back of the left shoulder, but there's a lot of muscles. This is the rotator cuff here, and what that's doing is it's connecting right into the back of that bone. And you can see there's the tricep down here, and we have a lot of ligaments, those are the white areas there, that are holding that shoulder into the joint. And there's also, as going through there, there's also a lot of nerves that are going through the shoulder area and into the arm. So now we have muscles, we have ligaments, we have the bones to pay attention to, and we also have the nerves that are coming out of the neck actually and going through this area. So when we first have you here, one of the first things we're going to do is, besides go over your history, how did you get your shoulder pain, or what are the things that have been contributing to it, what else are we going to look at? We're going to look at your range of motion in your shoulder. There's a lot of range of motion in the shoulder. It's a lot different than if you were just bending your elbow. We have lots of different ranges for the shoulder that we have to test. We're going to look at your reflexes. We're going to look at your muscle strength. And then we're also going to look at your posture, because if you think about it, if you have bad neck posture, it can absolutely strain the nerves that are going through the shoulder. So I'm going to look at what your head is doing over your traps and your shoulders here. Is your ear going in front of your shoulder, or is it sitting right over the rest of your body? Most of us these days with computers, these days with phones, unfortunately, most of our posture is not with your ear over the shoulder. The ear will tend to go forward, as you can imagine. So that could put a lot of strain right into here as well. So then we have to look at, what do those muscles feel like? How tight are they around there? And what's actually going on in the shoulder joint itself. So one of the things that we're going to do, besides our chiropractic adjustments, and when we do that, we're going to try to actually reposition the shoulder into the joint a little bit. If we find that there's a minor misalignment, otherwise known as a subluxation, we might try to work the joint back to try to help get it into the joint a little bit better. It's not painful, it's just a matter of trying to help it set in there. Next thing we're going to do is, one of the things that we'll use is something like this massage gun to really work on the muscular part of things. When you have that much muscle tension that's surrounding the shoulder, sometimes the body doesn't know how to release it. So we get in with the massage gun and we just kind of work through the different areas here. Now, some of you might have these, but we're going to do it in very specific areas and very specific angles to make sure that A, we're doing it properly, and B, maybe we can even teach you how to do some of the things at home depending on what's going on with your shoulder. All right, so we're going to use that. Now, some of the other things that we're going to do is we have to look at what are the other therapies that we can do to try to allow the shoulder to heal at a faster pace. Many of you have had shoulder pain for a long time. You've maybe potentially had some arthritis in there. What we have to do is try to find out what is the fastest way that we can get that shoulder to heal, and what parts are actually going on that are affecting the shoulder. So when we're trying to just calm the shoulder down, we're going to use something called cold laser therapy, which is this little joint right here. Okay, what this is here, it's called a laser because it actually is a laser, not like a big Star Wars laser. But what it does is that we're going to take this and put it right on the shoulder here. If you look at the skin, this is a targeted laser that we're going to use. And what this does is it speeds up the healing within the joint. So if I were to use this on my thumb, let's say if I were to just roll this on my thumb, I'm literally speeding up the healing inside the joint so that the body knows what to do. It's all it does is light a fire under the cells to get the healing process started. So if we have a specific spot, we'll put it right on the shoulder joint right here, maybe work that through and allow the cellular healing to occur. Let's say it's a larger area. Sometimes we have a larger area that we have to work with instead of just a smaller area. Well, for that, we have a larger light. And what we use is this red light therapy, otherwise known as PBM or photobiomodulation. And we're going to use this, we're going to let this hit a much larger area of the shoulder. What this does is it's not hot, it's not cold. You might feel it warm up a little bit, but we're trying to get, again, let the body get the healing going from the light itself. Your body is actually responding to what's happening with these lights and actually getting very excited so that the body can continue to heal as fast as possible, okay? Just getting you healthier and stronger as fast as we can. Now, if we look at the shoulder and we determine that, yes, some of it is shoulder pain, but other parts of it are neck related, we have a couple of things that we're going to do. Number one is we're going to work on ultimately your posture, okay? Because again, if I have a posture that's going to do this, I'm immediately putting strain into those nerves. And eventually that, if you've had shoulder pain, sometimes some of you know you might have had it go into the elbow, into the arm. All of this is happening because of the stress and strain that's gone on just from bad neck posture. So we might use tables like this. What we'll do is we might position you. Let's say if your head was tilted this way, we can't let your body just know that this is its normal posture. We have to teach it how to do this. So we might position you on this table, for example, and we might position you so that we prop up your head to be able to put you in what we call the mirror image of your posture, okay? We have to look at your posture because everybody's is different, and we ensure that we're getting the proper correction for you as quickly as we can. We look at it through two dimensions. Primarily, we look at the front and back posture, and we're going to look at the side-to-side posture. We're going to take all of those, put it together, and figure out if that is contributing to your shoulder pain. There's one last thing that we can potentially do here. This here is called spinal decompression. Many times people that have had involvement of shoulder pain that's coming from their neck and the strain on the nerves, maybe there's a herniated disc in the neck that's actually involved that's creating that pressure. And if that's the case, this is the weapon of choice that we use. We use this to literally lift up the bones of the spine and take the pressure out of the nerves here. So many times we've seen people will come in and say, my shoulder hurts, but it's really coming from the neck. Well, when we put you on here, what this is going to do, there's a cable that will attach here, and all this is going to do is literally pull up like that. Your head would sit right in here. This pulls up, opens up the joint space, takes pressure off the nerves. Wow, my shoulder is doing a lot better. The tingling in my arm is doing a lot better. The pain in the front, right by the pec muscle, by the chest, is doing a lot better. All because all we did was allow the space to get free, give the discs a lot of breathing room, and before you know it, you're feeling so much better. So we use this all together to try to really figure out what's going to work for you. So everybody gets a tailored plan in this office to make sure that we are doing the absolute best for you that we can. All right, I hope this helps. I'll see you on the next video.